Ladies and gentlemen, the press conference will begin shortly.
Well, everybody, we're back today for our briefing, and I guess the thing that is the most profound thing that I could say to everyone is just this, is you see I've got 4 pages of stuff right here, so it seemed like yesterday we had covered everything that we felt like we needed to cover, and then there's just more and more and more stuff. I go back to what I've said over and over and over, and that is, it's not a time to panic. It's a time to be cautious. It's serious stuff. I've said this in every way. It's not a time to be afraid. It's a time to be smart in what we do. A time not to be weak, but a time to be what you already are, and that's West Virginia, Mountaineer Strong. Now, I would say without any question, we're better today than we were yesterday. Now, but it's going to get worse, and that's what we're the most concerned about. I'm sure you're watching on your TVs and everything what New York State is doing and California is doing and everything, where they're shutting down everything and they're making everybody stay in their houses and their homes and everything. And we have not done that yet here because, and we hope and pray we're right about this, because we were ahead of the curve. We did come out with precautionary things. We did come out proactively, and you have done very, very well in supporting and us all joining together, and you're doing the right stuff. Now, to our employers, I know it's tough, And we thank you for allowing our people to work from home. You know, to those that had no recourse but to shut down, I'm telling you, and I'm telling those that have lost their jobs, that without question, our nation is going to stand behind you as well as our state. And economically, you will be made as close to whole as is feasibly possible in every way. I know you worry, and I understand it. I'm a business guy. I'm not a politician. I got it. But first and foremost, you have got to dial into just this, the safety of you and your family, your neighbors, and all West Virginians. So from the standpoint of health, that's got to be first and foremost right now. Now, I've got a bunch of things here to report to you, and I'm going to go through them as quickly as I possibly can. I've already said just earlier that the sun's shining. It was raining in a lot of places this morning and kind of cloudy and foggy, I know that, but the sun's shining. Every day that goes by, we have a better and better and better chance of getting better. And it's just simply just this. You know, there's medicines coming that have a tremendous amount of promise to be able to shut this thing down. In the meantime, you surely wouldn't see the state of California and the state of New York and these states just totally shutting down if it weren't really, really, really serious. So please continue to join with me, follow the instructions that we have, help the elderly, go to the grocery stores for them, absolutely wash your hands in every way, try not to touch your face. I'm not very good at that. I'm trying. And everything. Try hard to not touch your face. Stay a distance away from everyone if you possibly can. You know, 6-foot rule is really important. And absolutely avoid any type of crowds of people. Now, if we do that, the secret to every bit of this, and I want you to not get tired of hearing me say this, but the secret is that is our power. That's our power. That's our power to stop this thing. Our power has been given to us, and all we've got to do is stay apart. And this engine that is running dies because the engine has got to have us together to spread. So all we've got to do is stay apart. Now, today, you need a little bit of an update. We were able yesterday to purchase 100,000 N95 surgical masks and 275 sets of highly protective suits with special filtering and everything that can be reused. And so with all that, 30,000 of these masks are going to go to our first responders. You know, we need to take care of our volunteer fire departments, you know, but our first responders, law enforcement's corrections and everything like that, they'll have 30,000 of these masks. And we should have the mask and we should have the protective gear in. I think they come in on Tuesday and Thursday of next week. You know, we'll be shipping them out. Please, if you need these type masks and everything, notify our people and we'll get them to you immediately. And the rest of them are going to go into the DHHR for distribution to our medical providers. Now, some good and some bad here. Today, we're going to have to close all of our lodges at our state parks. Our lodges are occupied, or I think the number is 69% of those guests that are in our lodges are from out of state. All of our positive tests, I think now we know have people that have been left the state and come back or whatever like that. So do you hear me? In our lodges where we're really close together and we're exposing the people that are working in those lodges, 69% of those people are from out of state. we got to close the lodges. Now, it doesn't mean we're closing down the parks, and it does not mean we're closing down our campsites or our cabins. We want you to enjoy the parks. We want you to get outside. We want you to bike and hike and fish and get outside and stay away from people. This wonderful, pristine air in our parks will give you all the calming and the correct places to be. Enjoy those with your family. Absolutely go to our parks and enjoy the parks. We just got to close down our lodges. Now, in addition to that, 85% of those riding on our Hatfield and McCoy's trail systems are from out of state. You know, at all the trailheads, at all the little communities, we're flooding people into those communities and everything. And effective at midnight tonight, we're closing the Hatfield and McCoy's trails. I want to proudly report to you that all of our trout stockings are going to remain in place. I don't mean this in a derogatory way, because this gentleman has been, in my opinion, way out in left field a whole lot, but Delegate Isaac Spinagle has come out and recommended that we stop our trout stockings. Well, we're not going to stop our trout stockings. That's the silliest thing under the sun. I mean, just imagine just this. What are we going to do with all the fish that we have that have built all up and everything? You know, Steve McDaniel just said, you know, we're going to have to just dump the fish out on the ground in a lot of situations because we don't have anywhere to keep them. You know, and from the standpoint of just what we want people to do, we want people to go out and enjoy fishing. We want people to get out and get out in the outdoors. This is where we can be really apart. So absolutely, we're not going to stop our trout stocking. That's silly in my book. Our restaurants throughout the state, and I made a note on this, and I think it's on our screen, or it's going to be on the screens here somewhere and everything, but our restaurants out of state, you know, I mean, throughout the state that are serving carry-out food, we're getting a tremendous amount of calls, you know, that Chelsea Ruby is telling me about and everything that's coming into tourism and everything, of people wondering where they can pick up food. And so that's going to be on our website or whatever, you know, that where people can see that. Kind of along, you know, that ties into this is just this. Our Ag Commissioner, Kent Leonhardt, is surely right on top of his game and on top of what's going on there. And he's doing great work. He's done great work for us, a bunch of that, you know, for a long time. You know, he wants us to make sure that we understand that our farmers markets and our livestock markets are going to remain open, as well as our feed stores. Now, trust me, he's right on top of this. He called me earlier today and wanted me to make sure that everyone knows that, and that basically the net of the whole thing is we've got to keep our food channels open, and he's already put in place, you know, at the auctions for the livestock stuff, and a way to keep spectators out and keep people away, you know, or separated, and they're already on top of all that, but we've got to keep our food chains open, guys. And so the net of the whole thing is those that are going to grow vegetables and bring fresh vegetables to our markets and so on like that, all that's going to be in place, and all that's going to be out there for us to enjoy. Now, I guess today, I guess now I'm going to jump over to our Attorney General, who's again done phenomenal work. You know, Patrick is on top of his game all the time. He always, he always comes to me and says good stuff and everything, and tells me what we can do and what we can't do, and he is surely right on top of his game, and you'll hear from him in just a few minutes. But today I'm signing an executive order to suspend several rules and regulations And I'm going to just hit the highlights of it real quick, but it's going to be cutting the red tape to get our healthcare workers to work. It's going to be extending deadlines for renewal of driver's license that can be extended. It's going to be changing the regulations and the requirements and the deadlines for continuing education are going to be extended. We're going to be extending deadlines for vehicle inspections, extending deadlines for fees and for license for businesses, and expanding telemedicine. And the full details of this are going to be discussed maybe a little bit more by Patrick, and they're going to be available for you at the end of this press conference. Okay, let me see here. Okay, now I'm over to Erica, who heads up our Red Cross in our state and does a phenomenal job, and this is more serious stuff. Erica's going to tell you later, and I'm telling you now, that we need people to give blood. We're in a national meltdown as far as needing blood, but we're also in a West Virginia semi-meltdown, and we need people that can to give blood. And so she'll tell you a whole lot more about that in just a little while, but it's really, really important, and it does save lives, but in this situation, we really need it, and it will save many lives. I want to clean one thing up, from yesterday's conference and everything, where I said, if you need to choose for yourself your grieving process when you were to lose a loved one. And so if, you just have to be smart and be wise. Lots and lots of people go to funeral homes. You stand close together and all that. And so just watch what you do there. Wash your hands. Try to stay apart. Your grieving process is so private and so important in our lives that whatever you choose to do, I support. But I want everyone to know I'm not sending an underlying message that we're going to have a bunch of people die. It doesn't have anything to do with that at all. It's just trying to be really smart as you go through a grieving process if you lose a loved one or whomever it may be. Now, I guess in review real quick, we've closed our schools and bars and restaurants and casinos and gyms and health clubs and barbershops and hair salons and today we're taking a little additional steps with closing our lodges at our state parks and closing the Hatfield-McCoy Trail. We're trying everywhere we can to stop and break this chain that can really cause us a problem. If you look around, other states are shutting everything down, and even to the point in time where Pennsylvania came right out and started naming a few things that they deem essential, but one of the things they deemed non-essential was coal. Well, I promise you this, we always should absolutely hold our coal miners in the highest esteem, and absolutely, coal is so essential, it is unbelievable. How essential it is to our nation, how essential it is to making steel, powering us, doing all the different things that coal has done forever. And to say that coal's non-essential, absolutely, you just have to be way out there in my book to say such a thing as that. I would caution our coal miners, just like I did, I think, yesterday or the day before, the bathhouses, watch. Stay away from each other as much as you can. Really, our coal operators ought to assist and try to help with our man trips, but just try as best you possibly can to stay separated. And for those working outside, they're working on a surface mine operation, do the same thing. but it's probably a little easier outside than inside as far as staying close to one another. I got to say one other thing real quick, and that is Electo, the people that had the hospital at Fairmont, and really the people that had the hospitals right across the Ohio line at Wheeling, you know, for whatever the reason may be, you know, they fell on tough times and everything. I've said it over and over. We should be appreciative for the time that they were there, but at the same time, you know, they fell on really tough times, and it was really, really hard on our people and everything. And so, but one of the things they did yesterday that was awfully good is they had some ventilators that were in the Fairmont Hospital, and these ventilators probably cost somewhere around $25,000 a piece, and they're going to just donate 16 of them to us, and the more the merrier. I don't know the condition of them and all that kind of stuff, and they may not be worth $500 a piece right now. I don't know the condition, but nevertheless, it was a nice gesture, and I thank them for it. Let me just see if I've got. Okay, the only last thing I have is just this one more time. We have got to listen to me in every way. You know, I love West Virginia and all of its people beyond good sense. And I mean that from the very bottom of my heart. There may be someone out there that loves West Virginia and its people as much as me, but there's nobody out there that loves it more, loves our people or West Virginia more. West Virginia can be the beacon of the world right now if we'll just do everything in our power to stay apart. You've got to realize we are an elderly state, and we are a high-risk state, the #1 highest-risk state. Now, if we don't stay apart, it's going to end bad, and we're absolutely going to have a bunch of people die. But the efforts of what all these great people that are with me right here continue to do, and the efforts of what you're doing, absolutely are making us become the potential beacon. I think we've got, is it 5 positive tests now, or 4?
We actually have 7 now, Governor.
Okay, we've got 7.
Yes, sir.
All right, now, with that, almost every one of those tests, or maybe all of them, people are leaving and going across borders and coming back, and that's a problem. Try not to do that if you can help it. Absolutely wash your hands. I plead with you to stay apart, and I plead with you to help the elderly. For crying out loud, you know, my executive assistant, I said it the other day, she was at the grocery store, and she said she saw 10 or 11 elderly men walking along and trying to push their cart and trying to get their groceries, and you know how afraid they are. You know, we've got to help our neighbors in every way. I'm really counting on you now. You've got to join me. You've got to remember your power to stop this thing, your power to let the world know what a diamond in the rough they've missed before with West Virginia. And then all kinds of people come to West Virginia someday soon when all this is gone. Your power is just one thing, and that is staying apart, staying smart, not being afraid, absolutely not being afraid. So I mean it when I tell you I love you, and we're going to stay at it, and we're making progress, and so go catch a trout. Make you feel better too.
Ladies and gentlemen, as part of our briefing today, our friends with the media are once again joining us by teleconference. We will be taking their questions in just a moment, but first, we're going to take some comments from a few of our panel members. And first up today will be Erica Manny, the Chief Executive Officer of the American Red Cross.
Thank you. As the outbreak of coronavirus COVID-19 continues to impact our communities, we at the Red Cross are asking for your help to ensure that we have the blood supply needed to take care of hospital patients here in West Virginia and across the nation. Through yesterday, over 5,000 blood drives have been canceled due to concerns around coronavirus, and that has impacted over 170,000 blood donations. That's impacting us right here in West Virginia as well. As the concerns about coronavirus rise, the Red Cross has 3 vital messages. Donating blood is a safe process, and people should not be concerned about giving or receiving blood during this challenging time. More healthy donors are needed to give now to prevent a blood shortage and an additional health crisis. If you are hosting a blood drive, please keep the scheduled blood drive on the books, allowing donors the opportunity to give life-saving blood. At the Red Cross, we're also taking additional steps to ensure the safety of staff and donors at any Red Cross blood drive. The Red Cross only collects blood from individuals who are healthy and feeling well at the time of the donation and who meet other eligibility criteria, available on redcrossblood.org for your information. We are now pre-screening all individuals by checking their temperature before they enter any Red Cross blood drive or donation center, including our own staff and volunteers. At each blood drive and donation center, Red Cross employees follow thorough safety protocols, including wearing and changing gloves, routinely wiping down donor-touched areas, using sterile collection sets for every donation, and prepping the arm for donation with an aseptic scrub. Additional spacing has been implemented within each blood drive to incorporate social distancing between donation beds and stations within all blood drives. The average blood drives are not large gatherings, and these mitigation measures will help keep blood recipients, staff, and donors safe while making sure that our nation has the blood supply to take care of patients who need it every day. If you are feeling healthy and well, please see if you're eligible to give blood and make an appointment to donate as soon as possible by going to redcrossblood.org, calling 1-800-RED-CROSS, or downloading and utilizing the Red Cross Blood Donor app on your phone. Please help us prevent another health crisis by coming out and ensuring our nation's blood supply. Thank you.
Okay, that was Erica Manny, the Chief Executive Officer with American Red Cross West Virginia Region. Next, we have West Virginia Attorney General Patrick Morrissey.
Well, thank you very much, Governor, for providing me the opportunity to be here, but even more importantly, for having our office work so closely with your staff to identify different ways that we can help provide some relief to consumers and to affected businesses here in the Mountain State. I think many of us know that people are hurting very badly right now in the state of West Virginia. There's a sense of lack of calm on economic security and health care security. Some of the things that the governor and I have been working on are designed to address those issues. Through what you're going to hear today, through the governor's proclamation, there are going to be expanded opportunities for telemedicine here in the Mountain State that's going to help increase the capacity to deliver health care, to diagnose and treat patients who might be affected here in the Mountain State. Our offices have been working closely together to identify different types of regulations that might get waived to provide relief to consumers, whether we're talking about delays on the vehicle inspection or the licensing. We're looking to make people's lives easier because that's critical. And as different ideas continue to come up to the governor's office and our office, we're pledging to work closely to do close legal review on those issues so we can provide good guidance on different regulatory relief and consumer relief provisions that are going to help real people in everyday situations. I think everything we've seen to date comports with the governor's emergency authority, and we applaud the governor's office for all they're trying to do to provide that relief to citizens. So we're pleased to be here today to talk about those regulatory issues. We can also update people that we're working very hard on the bread and butter consumer issues impacting West Virginians. We've been in touch with many suppliers and retail establishments of issues pertaining to supply and price gouging. And we've received over 50 different pieces of information to date, calls and submissions to our office, and we'll be sending out cease and desist letters today to various establishments who have not upheld the law. Everything we're all trying to do is to help provide that relief to consumers, maintain the integrity of the supply, and ultimately make sure that those price gouging laws are strictly enforced. If we see an instance where there's a violation of the law, we will step up, we will take action. And we're also going to continue to work with all state agencies to make sure that everyone is adhering to the law and to the state emergency authority. So, Governor, thank you for everything that you're doing, that your terrific staff is doing, and we're here to help every single day. And I want to also applaud the Red Cross. We do urge people to get out and make sure that you're donating blood. That's critical during this important time.
Absolutely. Thank you both. Thank you both in every way.
Okay, thank you, Attorney General Patrick Morrissey, everybody. All of our panel members, including West Virginia National Guard Major General James Hoyer and Department of Health and Human Resources Secretary Bill Crouch, will be on hand to answer media questions. Once again, Governor Justice and these state leaders are holding today's briefing, with media members joining us virtually to practice good social distancing. To ensure that all outlets have an opportunity to ask questions, each outlet will be given the floor to ask one question. The order has been selected at random. To media members, when we call on you, please remember to unmute the microphone on your end before asking your question. Please confirm your name and affiliation as well. Depending on time, follow-up questions may be permitted. Participants should use the chat feature on our teleconferencing platform to submit those follow-up questions. And our first question today, it's no coincidence, comes from WCHS TV and Kenny Bass.
Thank you very much. I have a question about hotel workers. There's been some concern communicated to us, and it goes along with what the governor said earlier about out-of-state visitors to our state parks and to the Hatfield and McCoy Trail. A large number of visitors to our hotels are from out of state, and many hotel workers have contacted us and are concerned if there's any thought that's gone to doing something with that industry as far as either, I don't know if you can close it, but certainly emphasizing cleanliness protocols and procedures with the individual hotel chains. Is that something that's on top of mind, Governor, protecting the hotel workers who are dealing in many cases with people coming in from out of state?
Well, Kenny, this is an easy one for me because yesterday or day before yesterday, the days are running together right now, but my daughter Jill, over exactly that concern. There's 1,600 plus people that work at the Greenbrier, and the Greenbrier has been around a long, long time. And she closed the Greenbrier, and the reason for closing the Greenbrier was all driven by looking out after the safety of those 1,600 people, plus the guests. But it was a real concern that a lot of people at the Greenbrier and a lot of people at our hotels are from out of state, especially a travel destination like the Greenbrier, and it's a hard decision to make. I'll promise you this. It was a really, really difficult decision for my daughter and her family. So from the standpoint of her husband, works there, and Elmer Capulse and just different people. So I know it was a tough decision, but it was the right decision, and so it is an absolute concern, and I would urge all of our hotel owners that if the predominance of their guests are from out of state, I would be very, very concerned about those people that were working there in the hotels, and I would urge them to look at some type of suspension, but from the standpoint of people within our state, that are working and everything else, you've got many, many hotels that are servicing those people, and they should try to stay open. So this has got to be a call for the people, you know, the hotel owners, and know what their guests are, and you know, that was the decision that was made by my daughter.
Thank you, Kenny, for your question. Our next question will come from Stephen Allen Adams with Ogden Newspapers.
Hello, this is Steve Adams with Ogden Newspapers. You just announced that we now are up to 7 positive cases. We were at 5 cases as of around 9:30 last night. Can you give specific information, because I don't see anything on the website so far as what county the 2 additional cases are from, and whether they had traveled out of state, and whether they're self-quarantining, those type of specific information?
This is Bill Crouch. I need to tell you that Dr. Slimp had to leave and be on a call. Part of what we're trying to balance with these news conferences or news briefings are to make sure we're as transparent as possible, that we give all of the information we can give publicly that is not confidential. So she is, her time is in huge demand right now. So she wanted me to give her apologies, but she felt she needed to be on that call. Yet we do have 2 additional cases. All I can tell you right now is the county of those cases. I don't have additional information. Again, we're trying to keep you updated as quickly as we can. So there are now 2 cases in Jefferson County. There are 2 cases in Tucker County. There's 1 case in Mercer County, 1 case in Monongalia County, and 1 case in Jackson County. The online update will be available sometime later today. We're trying to do that once a day to make sure everyone has all of the information that we can put out there. We decided to go ahead and announce these 2 because we had that information available for you.
Thank you, Stephen, for your question. Our next question will come from WOWK-TV. I believe Mark Curtis is on the line. Okay, until we can get Mark back, we'll move on to West Virginia News. Joanne Snodderly.
Hi, Governor. This is Joanne Snodderly with WV News. You mentioned extensions and waivers on some fees and deadlines. Have you considered extending the deadline for state income taxes?
You know, Joanne, all I would say is our tax department's working that, and they're working it very diligently and everything, and it is in the pipeline of consideration, and you know the extensions, you know, on the federal, you know, level. So it's surely in the pipeline, and we're working it. We don't have a final decision on that as of yet.
Okay, Joanne, thank you for your question. Our next question will come from the Dominion Post and David Beard. Not hearing David on our end, so we're going to move on now to West Virginia Public Broadcasting and Brittany Patterson.
Hi, Governor. This is Brittany Patterson from West Virginia Public Broadcasting. Given that we are still experiencing a foster care crisis in the state, what is happening with home visits, both for the elderly and vulnerable children? And have you given any other directive to DHHR regarding how foster care protocols should be handled during this time?
Bill, I think that's you.
Bill Crouch. We are providing additional training to those individuals that go into the homes and provide services for our elderly population. So those services have to continue, and I need to say we appreciate very much what our workers are doing out there and the workers for our subcontractors. It is important that our elderly, our children, and others, and our facilities, the individuals we are responsible for right now, continue to be served. Those are essential and necessary services for the state, and they will continue. But we are trying to provide additional training in terms of safety and making sure folks have what they need to provide those services.
Brittany, thank you for your question. I will remind all of our...
Hold up just a second. Let me add a little bit to this. You know, first of all, you know, I want to take a second right now to thank all the people, all the workers, you know, that all of our state employees that are doing a magnificent job, and that's all there is to it. And, you know, there's lots of different areas, you know, where we should be really thankful. I mean, you know, I look at our general here with the National Guard, General Hoyer, and I look at our secretary, you know, Secretary Crouch, and all the great work that Erica and Patrick Morsey are doing. And I just think all of the work that goes on behind the scenes that people are doing in a situation that this is not just a task you take on. This is a fluid situation that's ever changing all the time. And really and truly, I commend everybody for the great work that everybody's doing. And I just say, hang in there and keep doing that great work, because you're not unnoticed, that's for sure.
We're going to move on now to our next question asker with West Virginia Metro News and Brad McElhaney.
Hi, Governor, and everybody. Thank you. You know, Governor, you mentioned that you don't think there's a need now to close businesses that would not be considered life-supporting or critical, but I do wonder if it comes to that suddenly, has there been any thought to the process of determining what West Virginia businesses should remain open and which should be closed by government mandate?
There's no question. There's no question the thought process doesn't leave any of our minds, and we are preparing lists nonstop, you know, to those businesses that we feel like are essential and everything. And let's just say that we're just hope and pray that we're not going to get to that, and that we were a little bit ahead of the curve as far as maybe what others should have done. You know, we did, and let's just hope and pray that we're not going to have to get to that.
Okay, Brad, thank you for your question. Our next question comes from WSAZ TV and Amanda Barron.
Can you hear me okay?
Yes, we can hear you.
Okay, sorry, I cut out for a second there. Hi, everyone. I wanted to ask two questions. What do you say, Governor, to businesses like the auto auction? We've been taking a lot of calls in the newsroom about that specific business that deals with many out-of-state customers. Also, there is a group in Honduras right now from West Virginia. They were there on a trip, and Honduras, without warning, shut down travel, and we were just wondering if there's anything being done to work to get those folks back.
Okay. Bill, do you know anything about that?
I do not know anything about the Honduras question. Sorry.
Okay, it's a group from Morgantown.
I don't know anything about that either, but Amanda, was your first question in regard to the car dealerships, you know, with people coming in from out of state?
Yes, just about businesses that deal with a good amount of traffic from out of state. What do you say to those business owners?
Well, I think, I kind of said the same thing, I'd say the same thing that I said about the hotels and everything, in that it's not, I've said this many times, but I believe the virus is here. I believe it's been here. We all believe that it's been here. You know, as we're expanding testing and as we're going further and everything, we expect it to get worse. If we can keep it as Dr. Clay Marsh said, you know, either a stream or a river, our healthcare, people can handle it, and we'll all be fine. What we've got to do is protect that surge. Now, to be more specific in answering your question, if I were running a business and I felt like that, I was in a border county, and lots and lots and lots of my traffic were out-of-state folks, I'd be looking at trying to step back and maybe take some extra precautions to be able to protect my people better, and I would be seriously considering the possibility of a non-essential business, looking at maybe closing for a couple of weeks or whatever, just let the dust settle and go on down the road. But I think for right now, we've got to leave that to our businesses. It may all change tomorrow. This thing is very, very fluid. But right now, I think we're okay, where we're at.
Amanda, thank you very much for your question. We're going to try to go back to Mark Curtis with WOWK-TV. Still nothing on our end, so we're going to move on now to the Charleston Gazette-Mail and Joe Severino. Nothing from Joe either on our end, so we're going to move back to Kenny Bass with WCHS-TV. He has a follow-up question about home health providers.
Thank you very much. The question is, home health care providers, as you all well know, are dealing with probably the most vulnerable population, elderly and in many cases ill and seriously ill. And many home health care providers have contacted our newsroom and say, all we're being told is to wash our hands a lot and use hand sanitizer. Is there anything they could or should be doing from a health standpoint to protect not only their clients, but themselves? And if there is, what could that message be for them? What should it be for them?
I mentioned earlier, this is Bill Crouch. The governor's made clear all of those services have to continue. The individuals that need care in the home have to continue to get care in the home. We've tried to, and we're still working on making sure that folks have proper protective equipment to do that, and that they have the knowledge to take appropriate precautions with regard to themselves and to the patients they serve. It's home health, it's our IDD population, elderly population in general. So those services have to continue, and we will do everything we can to support the folks that are taking care of those individuals.
The only thing I would add is the purchasing of additional masks, we've got to take every precaution, from gloves to the mask to, staying at a distance as best you possibly can. But we have got to have those services, and in many cases, those people are real troopers, and so we want to protect them in every way, but we've got to protect our people that need their assistance too.
All right, thank you very much, Kenny, for your question. We're going to do one more follow-up question. We're going to go back to Brittany Patterson with West Virginia Public Broadcasting.
Yes, thank you. Could you be a little more specific about what additional training looks like for those who are working with foster kids or the elderly population? And in terms of social distancing, for removing children from homes, how does that work?
Well, this is Bill Crouch. Obviously, you can't stay 6 feet away and provide services, some of the services that are required of our workers for the patients they serve. So what you do is protect yourself with gloves, masks, whatever might be needed. Make sure that you're protected for yourself and for the patients you're serving, and then, of course, proper disposal of the gloves, the mask, et cetera. So we have to continue those services, but we want to make sure the protection's there.
And the only other thing I'd add that, Brittany, is a great service that these people are providing that almost goes undetected is they're discovering the problems before those problems become a real problem and that they infect many others. They're also able to give instruction to those as far as hygiene and all the different things that they give them in one-on-one or whatever it may be like that give them more education so they'll do better and better things too. So these people provide all kinds of service to us other than just looking out and treating the patients.
Let me just add, we in our facilities, and I know hospitals are doing this, we take temperatures. We actually had my temperature taken before I came into the press room. We're following procedures everywhere to make sure that individuals do not have a fever, have an elevated temperature, and are not sick and are not coughing. So individuals, our staff that have upper respiratory problems, do not go out to serve these folks and do not take care of these folks. So that's very important as well.
They took my temperature when I walked in the office too. So we're trying to do everything we can possibly do on this end.
Okay, thank you everybody for your questions and for your comments. We apologize for any questions that we weren't able to get to today. If you have any follow-ups, please submit those in writing. We'll do our best to accommodate those. We'd like to thank our participants as well as our panel members. And with that, the governor's daily briefing has come to an end. Thank you, everybody.
Wait, before we go, got one more thing. You know, we won't have a briefing on Saturday or Sunday unless we have a real issue that needs to get to you and get to you immediately. And if that be the case, there won't be any takeoff of Saturday or Sunday and everything. But rest assured, everybody will still be working through the weekend, and we'll be right on top of everything. And as soon as we feel like you need to know something, we'll be letting you know.
And I will add that those reports that we do will be updated every day, even on weekends, so you'll have information, and press releases will go out all weekend as well.
Just one final thing I wanted to mention to everyone watching. If you see an instance of price gouging, call our 1-800 number, 1-800-368-8808. And as different issues of supply come up, let us know. We're going to make sure we enforce this price gouging statute very aggressively. Thank you.
Barring any other comments from the panel, we will wrap it up for today.
My last comment, give blood. Give blood if you can and everything. We need it bad.
Thank you, everybody, for participating, and have a great day.